Welcome back to the program, where our guest is Darrius Dinshah, and we're talking about the Spectrachrome therapy. The question I had was, how do the actual colors specifically help a person?
In this book, there are 12 different ways that some people believe through the eyes, through the skin, which is often used in hospitals now for babies with bilirubemia, RH babies and things like that, where the liver isn't quite mature enough. It transmits the energy through the skin, alters the pigment that's in the blood that can poison the brain, and you can be retarded by it. So that's one way. But our way is that we believe that every cell in your body is an electrochemical machine. Every single one, the billions and billions and billions of them. And the sum total of all the energy that they radiate, the ancients used to call your aura. And this impinging on your skin, on the aura that is coming from inside, alters that, and like a magnet working backwards or forwards, electricity makes magnetism, magnetism makes electricity. It works inside your body to change each cell. Each color that we list here, that there are 78 different attributes of the colors. There are 12 colors that we use basically. Red is basically for the liver. The pituitary is affected by green, digestion by yellow and lemon, reproductive system by magenta. So every part of your body has a specific function to perform, and in performing that function, it radiates a certain energy. Again, going back to that color wheel in the book, if it's excessive, we use the opposite color. If it needs reinforcement and it's weak, we use the appropriate color.
So even dealing with chakras, this may also be have some kind of relationship in that as well. It
could, but we recommend a person be awake, not playing a radio or TV, trying to get the placebo effect, the mental effect, from the bottoms of the feet sometimes all the way up. You cover the chakras, the reflexology points, everything possible. Whatever your body can absorb, utilize, will then do so.
Right.
But we want to cover every base. These particular ones are the one I mentioned earlier, the syntonics. In a controlled study conducted at Portland Optometric Clinic, children with dyslexia or other learning disabilities were treated with lime green light, lemon, which is the chronic alterative by spectrachrome definitions, and deep red light, which is our sensory stimulant. Treatments were administered with the patients looking at the light source. They didn't do it on the rest of the body. We believe it's a good idea to reinforce all of the body's aura. After 16 treatments, their field of vision, which previously was considerably narrower than normal, which is common in patients of this type, was then found to be normal or nearly so. Improvement also was noted in behavior, reading ability, length of attention span, athletic ability, and lessened complaints of headache and eye strain. What more can you ask of a therapy?
Yeah. It's very impressive, obviously. I have a question on a personal note. What about your cap? Obviously, it's a certain specific color.
No.
No. Okay.
No, it's just a cap. I wear a machinist's cap because I've worked in the gray collar industry most of my life, plus working on Spectrachrome's promotion. But the human brain weighs about 4 pounds. If you weigh 160 pounds, see what a small fraction that is? And yet it takes an immense amount of blood. There's an old woodsman saying, if your feet are cold, wear a hat. The body can divert circulation as needed, but never out of the brain.
True.
The brain is the last thing that would suffer the worst. Your fingers can drop off, you can get frostbite, you lose your feet.
But everything to save the brain.
Exactly. So as you age, and I'm pushing 72 in a couple months.
You look pretty good.
You continually often lose your natural insulation, so all the more reason you should wear a hat. So I recommend it. I, as much as possible, avoid being a hypocrite. If I tell you to do it, I'll do it myself. That's why I wear the hat.
Very good. We have about 1 minute left. As far as this serving people, children, anybody concerned with ADD very quickly, how do you see this working in a way that people, parents, or even teachers might be able to apply this in the classroom? And we've got about 40 seconds.
Well, you see how simple the device is. Most children at a very young age in schools, they take naps. It could be applied then, quite simply.
And even during their course of the day, during playing and
It could be at any time. However, this kind of lighting, this is a spectroscope which I showed to some of your staff. It is basically a Newtonian prism, and it shows you exactly the constituents of filters, regular light, incandescent light, this kind of light. These, after the show, if you wish to look through this, will show you how detrimental this kind of lighting source is, which is universal in schools, fluorescent lighting.
Yes, it's what you mean is it's
Well,
not very healthy.
That's what this set of charts is. What sunlight looks like, these ill-promoted neodymium lamps, which have virtually no yellow in them, typical fluorescence with huge emissions, and what these look like. Bad news for health.
Darrius, thank you very much.
Thank you, Mark, for having me.
Thank you very much, and hope we get more information from you in the future. Thanks.
We'll do what we can.
Okay.